Young adults today face unprecedented challenges. The world feels increasingly uncertain. The pressure to succeed is immense, and lurking beneath the surface is a silent epidemic, the devastating impact of drugs on mental health. We're not just talking about illegal substances like heroin or cocaine. Alcohol, prescription medications, and even cannabis, often perceived as harmless, are contributing to a generation struggling with depression, anxiety, and a growing sense of hopelessness. This isn't about preaching abstinence, it's about understanding the profound and often irreversible damage drug use inflicts on young minds. It's about exposing the insidious ways these substances hijack the brain's delicate chemistry, leaving young people vulnerable to a lifetime of mental health struggles. This is a call to action. We need to shed light on this crisis, break down the stigma surrounding mental health and addiction, and provide young people with the support they desperately need to heal and reclaim their lives. The time to act is now. The future of an entire generation hangs in the balance. The numbers paint a bleak picture. According to the National Institute on Drug Abuse, over 70% of young adults with a substance use disorder also have a co-occurring mental health disorder. That's millions of young people battling both addiction and mental illness, often in silence and shame. Consider this: alcohol, a legal and readily available drug, is a leading cause of death among young adults. It's also a major risk factor for depression, anxiety, and suicide. Cannabis, increasingly potent and widely available, can trigger psychosis and worsen existing mental health conditions, particularly in those with a genetic predisposition. Prescription medications, while essential for treating certain conditions, are often misused and abused. Opioids, prescribed for pain relief, have fueled a devastating epidemic, leading to widespread addiction and overdose deaths. Stimulants, used to treat ADHD, are often abused for their focus-enhancing effects, leading to anxiety, paranoia, and sleep disturbances. These statistics are more than just numbers. They represent real lives shattered by addiction and mental illness. Each data point is a son, a daughter, a friend, a classmate struggling to cope with the overwhelming burden of these intertwined conditions. To understand the devastating impact of drugs on mental health, we need to delve into the intricate workings of the human brain. Imagine a complex network of billions of neurons, communicating through chemical messengers called neurotransmitters. These neurotransmitters regulate mood, sleep, motivation, reward, and countless other essential functions. Drugs, whether legal or illegal, disrupt this delicate balance by flooding the brain with artificial surges of dopamine, serotonin, and other neurotransmitters. Over time, the brain adapts to this chemical onslaught, reducing its natural production of these crucial chemicals. This leads to tolerance, dependence, and withdrawal symptoms when drug use is stopped. Alcohol, for example, acts as a depressant, slowing down brain activity and interfering with communication between neurons. This can lead to feelings of sadness, anxiety, and difficulty concentrating. Cannabis disrupts the endocannabinoid system, which regulates mood, memory, and appetite, leading to impaired cognitive function, memory problems, and increased anxiety. Stimulants like cocaine and amphetamines flood the brain with dopamine, producing feelings of euphoria and alertness. However, prolonged use depletes dopamine levels, leading to crashes marked by fatigue, depression, and intense cravings. Opioids like heroin and fentanyl bind to opioid receptors in the brain, producing feelings of euphoria and pain relief. However, chronic use leads to tolerance, dependence, and a high risk of overdose. In today's hyper-connected world, young adults face relentless pressure to fit in, succeed, and project an image of perfection. Social media, while offering a platform for connection, often creates unrealistic expectations and fuels feelings of inadequacy. The carefully curated lives depicted online can leave young people feeling like they're not good enough, thin enough, or successful enough. This pressure cooker environment can drive young people to seek solace in drugs and alcohol. Social media normalizes drug use, with influencers and celebrities often glamorizing partying and substance use. Peer pressure, both online and offline, can be intense, with young people feeling like they need to partake to fit in or be accepted. Social media can also make it easier to access drugs. Dealers operate openly on platforms like Instagram and Snapchat, targeting young people with special offers and discreet delivery options. The anonymity of the internet lowers inhibitions, making it easier for young people to experiment with substances they might otherwise avoid. Section 5. Seeking help and finding support resources for young adults and their families. It's crucial to remember that addiction is not a moral failing but a complex medical condition that requires professional treatment and support. The first step towards recovery is acknowledging the problem and seeking help. There is no shame in asking for help, and there are numerous resources available for young adults struggling with drug use and mental health issues. Start by talking to a trusted adult, a parent, teacher, counselor, or healthcare professional. They can provide guidance, support, and connect you with appropriate resources. There are also numerous hotlines and online resources available, offering confidential support and information. Treatment options vary depending on the severity of the addiction and co-occurring mental health conditions. Detoxification programs provide medical supervision during the withdrawal process, ensuring safety and comfort. Inpatient rehabilitation programs offer intensive therapy, counseling, and support in a structured environment. Outpatient programs provide flexibility for those who can't commit to full-time treatment. Support groups like Narcotics Anonymous and Alcoholics Anonymous provide a safe and supportive space for individuals in recovery to connect with others who understand their struggles. Family therapy can help repair relationships strained by addiction and provide loved ones with the tools and support they need to navigate the recovery process. Section 6. Breaking the stigma. Changing the conversation around mental health and addiction. Stigma is a powerful force that prevents individuals from seeking help for drug addiction and mental health issues. It thrives on shame, silence, and judgment, perpetuating harmful stereotypes and misconceptions. Breaking the stigma requires open and honest conversations about these issues, challenging misinformation and promoting empathy and understanding. We need to move away from blaming and shaming individuals struggling with addiction and mental health. These are complex medical conditions, not character flaws. Instead of judging, we need to offer support, compassion, and access to treatment. Education is key to dismantling stigma. By learning about the science of addiction and mental health, we can challenge misconceptions and promote understanding. Sharing personal stories of recovery can inspire hope and demonstrate that recovery is possible. We also need to advocate for policies that prioritize mental health and addiction treatment. This includes increasing funding for research, expanding access to affordable care, and implementing prevention programs that address the root causes of these issues. Section 7. Recovery is possible. Stories of hope and resilience. While the statistics and the science paint a stark picture, it's essential to remember that recovery from drug addiction and mental illness is possible. There are countless stories of individuals who have overcome these challenges and gone on to lead fulfilling and meaningful lives. These stories of hope and resilience remind us that addiction is not a life sentence. They demonstrate the transformative power of treatment, support, and self-discovery. They offer a beacon of hope to those struggling in the darkness, showing them that a brighter future is within reach. One such story is that of Emily, a young woman who battled opioid addiction for years. After multiple overdoses and a stint in jail, she hit rock bottom. With the support of her family and a compassionate treatment team, Emily entered recovery. Through therapy, support groups, and a newfound passion for art, she rebuilt her life. Today, Emily is a successful artist and advocate for addiction recovery, using her story to inspire hope and break down stigma. Emily's story, along with countless others, reminds us that recovery is not a linear journey. There will be setbacks and challenges along the way, but with determination, support, and a belief in oneself, it is possible to break free from the grip of addiction and achieve lasting recovery. Section 8. A future free from addiction, prevention, education, and early intervention. Addressing the complex issue of drug use and mental health in young adults requires a multifaceted approach that encompasses prevention, education, and early intervention. We need to create a society that supports the well-being of young people, provides them with the tools to make healthy choices, and offers timely intervention when needed. Prevention efforts should focus on addressing the root causes of drug use, such as stress, trauma, peer pressure, and mental health issues. This includes promoting positive coping mechanisms, fostering healthy relationships, and creating supportive environments in schools and communities. Education plays a vital role in equipping young people with the knowledge and skills to make informed decisions about their health. Comprehensive drug education programs should go beyond scare tactics and instead focus on the science of addiction, the risks associated with drug use, and the importance of seeking help when needed. Early intervention is crucial in addressing drug use and mental health issues before they escalate into more serious problems. This involves identifying at-risk individuals, providing early support services, and connecting them with appropriate treatment resources. By investing in prevention, education, and early intervention, we can create a future where young adults have the knowledge, skills, and support they need to make healthy choices and achieve their full potential. It's time to break the cycle of addiction and mental illness and empower future generations to lead healthier, happier, and more fulfilling lives.